point that we can work on. And these are things that I actually use at the clinic to alleviate headaches, shoulder pain, jaw pain, and carpal tunnel. So there's going to be about 12 points that we're going to talk about today. So before I start, I just want to explain to you who I am. I mean, most of you know who I am. I'm a doctor of chiropractic. I've been doing this for over 22 years. And also I'm a martial artist. I've been doing that for over 43 years. I come from a 3-generation martial art family. I want to teach. I like teaching. I like educating the public. There are things that I know that's common sense for me may not be common sense for a lot of people. So if we can share knowledge and pass it forward, I believe that it starts with us, and if we can actually improve all around, it's going to help out in our society. Okay? What is acupressure point? I mean, people say, well, I do acupressure, pressure points, shiatsu point. What acupressure point is actually a digital pressure on acupuncture meridian. We have a lot of channels going in the front, the back. There's 12 different meridian points, and these meridian points are supposed to flow well, so that way your body can function well. So according to Asian medicine, acupressure and acupuncture is inserted into these muscles in different meridians to allow better qi or qi flow. When you don't have very good qi or qi flow, it's like a river that's being occluded, and if the river doesn't circulate, it causes wasting problems. So acupressure is basically working on the meridian channel. So today we're going to be talking about certain points that we can actually alleviate and better qi or qi flow to different parts of the body. So another question is, what is trigger point? How many of you have heard of that before? Trigger point, according to Western medicine, is when the muscle gets chronically fatigued and chronically spasmed. So when you're in front of the computer, for instance, you're doing this and the neck starts to get tightened and one part of the muscle gets spasmed, that's typically trigger point. You have trigger point on the SCM right here. You may get refer pain in the eyes, top of the head, back of the skull, or even jaw pain. Point on the top of the trapezius can cause temporal headaches. And trigger point is refer pain. These refer pain are a result of refer pattern from the muscle spasm. Okay? So again, the acupressure and trigger point could actually coincide. But trigger point does not mean that it is acupressure or acupuncture point. And also the trigger point could also lead to improper qi flow and nerve irritation as well. Now the final question is, what is nerve irritation? Okay, so in our body is controlled by the nerves, and these nerves allows us to hear, see, taste, feel, and also move our muscle, and also control automatic nervous system, such as heart rate, your breathing. These nerves are controlled by our brain, even through our spinal cord and peripheral nerve. So sometimes what happens is when you have something called spinal misalignment, or when the spine starts to cause a lot of rotation and twist, it can cause irritation to the nerve. And when you have irritation to the nerve, a person may have numbness or tingling or weakness, or even affect systems internally as well, such as digestive tract or sleep problems. So nerve irritation, trigger point, and acupressure point, they all seem similar, and they are. They do kind of coincide, they work together, but they can be very distinct different things, okay? So what causes trigger point, acupressure meridian dysfunction, nervous system imbalance? Simply put, 3 things. One could be physical trauma. If you had an injury, if you had a car accident, you fell off a bike, or you had a ski accident, these actual trauma can cause muscles to spasm up, qi or qi flow to actually interrupt it, or nerve irritation. Second is life habit. If you're always sitting in front of the computer, not active, eating bad food, not exercising, that can cause the body to age quickly. And last is mental stress. When we're worried and tension, emotional stress can cause disturbance to the muscle or dysfunction as well. So ask yourself these questions. Is your body trauma-free? Is your body, do you have a good life habit? Also, are you clear of mental stress? So we always believe that health is not just body, but it's also body, mind, emotion, and spirit as well. We're going to talk about headaches. 3 acupressure point that helps with headache. And typically these headaches are tension headaches, migraine, cluster headache. That's because it's related to the neck. A lot of times when people have chronic headache, they may lose that proper C curve, and they start to reduce curve and create kyphosis and degenerative changes. The thing about the neck is there's a lot of small muscles right behind the skull and shoulder that causes compression to the vessel and cause tension to the scalp, which leads to headache. So the area that we're going to talk about is GB20, which right at the base of the neck, there's one point right here, and the other point right here. Okay? So these are the 2 points that we're going to work on. And this is a point that I use acupuncture to help alleviate a lot of headaches. So typically what we can do is we use our index finger or middle finger or index or thumb, and we use the thumb to create a more of a circular motion. Okay? Right here. Is that a little bit sensitive? Okay. And now on the opposite side, we can do it with our middle fingers as well, right there. Creating a circular motion. Or bilaterally, we can use 2 hands or just 1 hand using thumb and index finger like that. What is that? That's the index finger right in the middle, right here. You apply pressure. So typically we do this. Okay? These are excellent points for headaches. Tension headache, migraine headache, cluster headache on both sides. Okay? So why don't we kind of partner up and let's work on those points right now. So, right here, and right here. On both sides then. First thing to do is you stand on this side. You hold this one, right? Use this thumb. That's a result of muscles of mastication or chewing, and it's also related to upper cervical malposition. Example, whiplash or teeth injury. Okay? Temporalis and masseter. Now, what I've noticed from my experience is when people have TMJ problem, they may actually have some trauma to the jaw, but they may actually have TMJ problem without trauma. And typically people who have no trauma, why would they have TMJ problem? Because the position in the jaw is controlled by the upper cervical spine, which is the upper neck. When our upper neck is displaced, or you have loss of curvature, it causes muscular imbalance to the masseter muscle. Okay? We're going to work on a point called stomach 6 into the jaw. So the jaw right here and the cheekbone, the stomach 6 is right at the midpoint right here, which is this junction right here. So what we're going to do is this area is very sensitive, so you don't want to be putting way too much pressure. So typically using my index and middle finger, and do it one side at a time, and apply not such a firm pressure, but just nice and light to create that size that, then we do the opposite side, same thing. Okay? I don't recommend people doing it both sides at the same time. And gallbladder 3. So those points are mainly, so more inward towards the ear, a little bit higher, right by the scalp. Okay? These muscles are big muscles that controls chewing. Let's do the other point up above, stomach 7 and gallbladder 1 or 3, right around this junction. Typically, shoulder pain could be tear of rotator cuff. If you tore a rotator cuff, then basically you may, depending on how bad that is, you may need to have surgical intervention. However, we may have shoulder pain without even any tear, and that could be related to cervical neck again, dysfunction due to usually too much computer work. So the areas that we see that's neck related is around C5 and C7. Sitting down, their neck starts to kind of lean forward and cause punching effect, which causes irritation to the nerve that goes out to the shoulder as well. It actually is agitated when you have trauma such as whiplash, and then on top of whiplash, they don't take care of it and they do this. and they do this for 10, 15, 20 years, their body starts to get kyphotic. So first point we're gonna call is, we'll call it SJ15. Top of the highest part of the shoulder, right below it, there's a shoulder blade, and this is the point right here. Okay? So these are the 2 points. Now these, find the area that's high, go down lower, using my thumb, and using the other hand for support. Okay? And I'm applying pressure. Like that. Feel it? So left hand, support the shoulder, right hand, do the therapy. Now those of you who have a hard time with the thumb, once you find it, you can use a knuckle. You can use a tennis ball. Okay? These are thick muscle area. Or here, thumb here, applying pressure. See that? How's that feel? Now, once he's got lots of problems. Yeah, we can actually. So the top of the shoulder, we got a real tunnel. Okay? People who work for a computer doing this is a very common problem, carpal tunnel. But did you know that a carpal tunnel is caused by compression to a nerve called median nerve? But the carpal tunnel itself actually is in the wrist, but that median nerve actually comes from the neck. The nerve actually comes from this nerve called brachial plexus, and they originate around C4-5, right around this area. That's the origin. If this nerve is irritated here, it causes shoulder pain, it causes forearm pain, it causes carpal tunnel syndrome. First point is LI12, large intestine 12. Take 2 fingers above it. Okay? This is the point where we'll be working on right here. So from here, freeze, 2 finger, use my thumb, grab his hand, apply pressure. Feel it. Take that tender. Right in the thumb area, right in the middle of the fleshy point. That's the point right there. Again, this is a very sensitive area. I'll do a gentle pressure. Feel that? Is that too much? Okay. SJ5. 3 fingers from your wrist. Above. Very important point because this is where all the extensor tendon starts to work. When you lift up your finger. The reason why the best thing to do is when you start here, stand on this side. Put some pressure. Is your structure, your frame, just like the structure of a building, is that sound? Is it steady? Is it stable? What's happening with your neck? What's happening with your disc? What's happening with your curvature? You don't know that. And typically people will start to know that when they age and they have problems. Structure sound. Then we need to exercise and condition. Practice, practice, practice. But you can't practice something when you're broken. You can't work out and stretch out when you're broken. So we gotta fix, then practice. Then once the practice is done, then that's where you hit the target. Refinement, skills, acupuncture, laser, decompression, massage. Okay? All rehabilitation. These are things that I work with. Stretching, understanding. This is what you're at. If I have a blueprint of who you are, then I can give you advice to do self-help.